This is, hi, I'm Tasha Thompson and co-chair of the Justice Project Oversight and Planning Committee. I am officially calling the meeting to order of the JPOP Committee. Today's date is May 15th, 2025, and it is 2:04 in the afternoon.
Thank you. Anna, are you here? Do you want to read the land acknowledgement?
Absolutely.
Awesome. Next slide, Marty.
Sorry. Okay. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events.
Thank you. Beautiful. Okay, so a couple of the basics that are good to remember each time we are together. So keep your video on as much as possible. Rosa you get a get out of jail free card. If you're on Zoom, keep yourself muted except when you're speaking. Remember, of course, these are all open public meetings and will be recorded. And when we're in the open discussion mode, raise your hand, or on Zoom, you can use the raise hand button. Either one will work. And when you're using acronyms, please define what they mean so we can all be on the same page. And so we have a really great agenda today. Lots of good material. So we're going to take a few minutes on the Q1 2025 progress report. And Marty's also going to give us a little context for why those are important and why we look at them. Then we're going to look at prioritizing measures for the data dashboard. So this is part of the process that we've been working on with Julia from Village Reach, but she could not be here today. So she gave us instructions and we will follow those instructions and work on that today. Then we'll take moments to hear from all of you if you have any feedback on the 2025 implementation plan progress report. The first one ever. Here we go. It's very, important moment for us as a county. And we're going to give an update on the inmate focus groups, hear about the wellness center tour, and then have time for public comment. So any questions about the agenda? Hearing none, let's jump in. Okay, Marty, go ahead.
I'm going to just do the quick review of the action plan that I always do at these meetings, just to orient us in where we are in our process. So today is in green here, and we have on our action plan all of the things that Holly just mentioned on our agenda. Our next meeting will be a week late because of Juneteenth, so we're going to do the meeting on June 26th. And at that meeting, we expect to have the final or nearly finalized evaluation and performance measurement plan to review. And we also will be continuing to talk about data dashboards and how to reach out to the public with those and to get feedback on them. And we expect to be talking some more about the input we're going to get from inmates at the jail about jail and behavioral care center design. Hopefully we will have completed a survey by then. So, and also on this slide is a reminder that we have July as a summer recess. Okay. Reviewing the quarterly progress report summary. And I'll just jump in. All right, Holly?
Yeah, please do.
Okay. I just want to say that this report covered the first quarter of 2025, January to March. And here we are in May. talking about it. And the reason for the delay is that the executive's office produces these reports, and they do a long report, and it comes out the month after the quarter ends. And then we produce the next report, but usually we can't do that before we have a JPOP meeting because of the timing of when the executive's office has produced theirs. So here we are in May. We've got one done. It is posted online, and it is a summary. Again, it's a summary of what the executive's office long report that is looking at progress made on the 15 implementation plan projects. And the focus is on what happened over that quarter. And we try not to do too much, if any, forecasting, like this is what we expect will happen next. We're just focusing on what happened and moving it, to move that project forward. So I think I just, this slide is just saying what happens with those summaries that we do. The council staff posts them to the Justice Project website. And here we are today, your role identifying highlights to share via social media and perhaps other media. And then we are counting on all of you to spread the word about this, what's on the website and what's going on with these projects with your constituencies, your networks. And
Okay.
I'll pass it back to you, Holly, for a conversation.
Great. So I think I just want to flag that this is a really key function of the JPOP, which is to really facilitate and help with the transparency and accountability to the public on where we are with the implementation plan, and making sure that to the degree possible that people in our community are aware of the progress. So first off, let's do this. Raise your hand if you actually read the sheet. There's no shame here. Did you read the summary? Oh, nice. Okay. Okay, a couple people. Good. I can't see everybody. There we
I
go.
think I'll just stop share so we can,
Good.
you
Okay,
can
let's
see
try
a little
this.
better.
Let's try this again. We're going to practice our raise hand buttons. Did you read it? Did you have a chance to glance at it? Yes. Excellent. Okay. Thank you all. So the question is, if we're now going to produce some social media blast, right, that we can share with the community to make sure that they're tuning in and they're aware, and we don't have this big gap that we've been hearing about, where I don't know what's going on. What do you think people are going to be most interested in hearing? What would we cherry pick out to make sure that that story's getting out there? So who would like to start? One thing that you think would be useful. Yeah. Who do we have from the sheriff's office? I can just see your.
Oh, this is Tank.
Hey, Tank. Great.
Yeah.
Please go ahead.
I think one thing that would be useful is to let the public and the community know kind of if you will, the pecking order of all the projects. Because as the sheriff, I talk to people daily, and many people believe that the sheriff's office is the driver of all these projects and the organization that is making all the decisions for the projects, which is not true at all. So I find myself explaining that, and once I do explain it, people understand. But I think that's a big question out in the community that could be solved.
Great. Yeah. Excellent feedback. Thank you. Tasha?
Anytime anyone asks me about this, they primarily ask, where are we at with the jail? Do we have an estimated date for anything? And this, what's the size going to be? And I'm just like, I try and push. I mean, it's not clear on this. I just say we've gotten the owner's representative, then that leads me into what does that mean? Explanations usually. So
Great. Okay, so some just a reality check on that, which now luckily we do have more info through STV. Okay, what else? What else jumps out at you that you found interesting? Jason, yeah. Rosa, go ahead.
So I work out in Lummi, so I work with a lot of tribal people. And I think the concern I've heard from people out there where I work at is I guess is everyone, the addicts, the behavioral health, are they all just going to be put together in a new jail? Like there's just this it's just assumed, and I know we're not there yet, but like I guess just out there it's just assumed like, oh, they're just building another jail so they could just throw everyone in there as one melting pot. And the concern is how do you separate, what we've been working on, the mental health with the drug addicts, and then actual people that did these just crimes. So yeah, that's what I've been hearing a lot. Once people find out that I'm on this task force, that's usually the first thing they bring up.
Mm-hmm.
Thank you.
Thanks. So similar to the point Tank was making of just like kind of some basic understanding of what the project is. It seems like important that we need to reinforce. Yeah. Good. What else? For other people who looked at it. Jason or Trevor, Rob?
I think the format itself is really digestible and accessible to people who might not be familiar with the program. So I think that just the way it's laid out in sort of headings and bullet points makes a lot of sense, and is, like I said, is very accessible. And if you're talking about social media posts, I mean, to me, the natural, like the obvious way to go with it is just sort of like, what is JPOP, right? JPOP, and the name itself pops, right? Like it's right there in the name, because people
Nice.
hear that and might just
Yeah.
be what I have no clue what that even is. I know I did when I joined this. Like I mean, I was sort of a latecomer, so I think that just the like 5 or 6 main headings are the way to go as far as just like selling and explaining like what is JPOP. This is what we do: ensure oversight, increase access. And I don't know if you're talking like Instagram style social media where you can have like like a flip through, and each one is like like a headline blast or something like that. But I mean, these are all the things we're talking about, and I spent tons of conversation engaged in discussing all these things. And this is simplified in a way that people can really get the gist of it easily and digest it. And I think just focusing on the lines in blue as the bullet points as an explanation of what the committee has been working on would just be a good way to sort of frame that for people.
Yeah. Awesome. Thank you. Okay, in the conference room. And yeah, there you go.
I'm really interested in hearing out the survey, like inmate focus group feedback, because I highly prioritize hearing out lived experience of those that have entered systems of like incarceration and exiting those systems, because they have like firsthand experience of what it's like to be in a jail, going through the court system, interacting with staff members, possibly having lack of accessibility to documents. I know our law library, you have to print like pages and it'll cost like 10 cents. So there's like always a money barrier when it comes to like the courts. So I really want to hear out what inmates want to see when designing a new jail or a behavioral health facility, and young people. I know that there's a lot of concerns of the current jail right now. So before we finalize any design or any systems regarding the new jail, I would love to have those concerns addressed and acknowledged and also worked on. I don't want a new jail if our current one is not to the highest of its abilities. So yeah.
Great, thank you. Peter, I'm just wondering if it would be, I'm not sure that the JPOP knows about the new BCC committee. I'm wondering if that might be, this might be a good moment to share about that if you're in the headspace to do that.
Yeah, you bet. Yeah. I cannot remember the name of the last speaker. I'm sorry. I'd love to remember your name. Would you? What was that?
Bernie.
Great. Thank you so much for what you were saying. And also, Rosa, what I was going through my mind while the both of you were talking was how much I would like to be in the room with the folks you're talking about and addressing the various questions and hearing those questions, because what we are planning with our behavioral care center is so unique and interesting and forward thinking that I think that they would find it very interesting. So behavioral care center like the one we saw in Nashville is a model that is just starting to become used, and we would be pretty much the second, maybe third community to be able to have a co-located treatment facility for select folks with mental health and drug addiction issues, to get them out of the jail and into treatment, like 28 days of treatment on average. And it has been very successful in Nashville. We loved what we saw there. The group that Holly is referring to is a group of mental health professionals, prosecutors, and folks from corrections and public defenders. And the relationship between those folks in Nashville, we have those folks here, but in Nashville, it's the relationship that they have, and they're working together really, really well to look at the individuals coming into the criminal justice system and choosing the ones that have the greatest likelihood of being affected positively by the treatment offered at the BCC. It's very powerful. So we're getting those folks in our community together to begin talking about how we adapt this Nashville model to our community. And I am so excited to get that show on the road, because that's something that I've gone around the county talking with people about, and there's a lot of interest in it, and I think it's going to work here. Is that helpful? Is that what you're looking for?
Yeah, just to let people know that that the IPRTF formed another committee to actually work on, like, so what's that BCC going to look like and how's it going to work? Because a lot of questions were coming up, and Peter, like, hearing these questions and knowing that not enough people really understood the model, and that it's transferability, right, to Whatcom County. So they're digging in there. So that's really
It's very
great.
new. I mean, when people think of jail, they think of bars and concrete and everything else, and that's understandable. But the jail that we're building is not that. We're going to be using trauma-informed design principles, human-centered design principles, to design the entirety of the thing, not just the BCC.
Yeah. Thank you, Peter. Okay, Tasha and then Trevor.
So referencing the Nashville, and Peter and I had a great conversation with Nashville, one of the lead guys in putting that together. And so I have reached out to him to see if he'd be available next month to go over his PowerPoint and kind of explain the process and how and the successes that they've had. He appears he's on vacation. I got a bounce back of he'll be back next week. So I'm hoping to be able to set that up in the near, if not next month, in a future meeting, so that those of us that haven't participated in going to Nashville have the opportunity to ask questions directly to someone that is there as well. So thank you to Peter for connecting me with him. So.
And Tasha, is that something that other folks could come listen to that presentation, or would that be more kind of after the fact?
Well, I mean, I'm hoping that he'll do it at within our meeting. So again, it would be open to the public, and we could maybe advertise that specific discussion, maybe on social media, about what that actually means. We could actually push it out and engage the public to join us for that meeting.
The folks in Nashville who came up with this model and run it to this day, they are very interested in what we're up to. They have offered very graciously to spend as much time with us and our various groups as needed.
Awesome. I'm just thinking it'd be nice maybe if we could just make sure at least the JPOP all knows about it. Would be
I think
nice.
it'll be probably in this container.
Oh, it'll be in this
We
meeting.
can do it here. Yeah.
Yeah, I'm trying to set it up for one of our, specifically for our JPOP meeting, like take an hour out of the meeting to do just that. Yeah.
Perfect. Okay, good. Let's get that on the schedule then. Thank you. That's great. I didn't know. Okay, Trevor, you're up.
I just had a quick thought regarding information available to the public. And a lot of the feedback I get about systemic changes like this are like, how do I know anything's being done? Like, how do I actually know, like, how is it impacting me? So direct community impact seems to be kind of at the forefront of a lot of folks' minds. So I could see, I'm not sure exactly how the social media is going to be run. It's not an area of expertise of mine at all, but on the dashboard or somewhere, if, for instance, if there was a posting saying, hey, we've raised 14.2 of the $14.7 million necessary to build that 23-hour crisis center, you know, like that has like a direct community impact, you know, or we've just filled these positions for our SUDPs or for our mental health people, like things that let folks know that we're actually making moves in real time that have a direct community impact to establishing these different goals. I could just see that being really helpful.
Right. Yeah, great feedback. Thank you. And a good segue maybe to our next section, unless somebody has anything else on this. Okay, let's keep moving then. So very much in alignment with what Trevor was just saying is this whole question about, you know, moving from the Justice Project Performance Measurement Plan, which we've been working on with Village Reach, into eventually having a data dashboard. And in anticipation of that, Julia's asking that we spend a little time on this question of what do we think of all the things that we could measure and be presenting to the community? What are going to be the ones that are going to be most important? So I'd love to hear from everybody who's a member. And by the way, if you're here as you're not part of the JPOP, just remember that you have time at the end of the meeting to share your thoughts, but everybody else, we've got two major questions. So one is just the thinking about the story we want to tell the community through the data dashboard. What things on the Justice Project Performance Measurement Outline, the things we talked about at our last meeting, do you think the community will be most interested in seeing? And do you think that the community is interested more in the progress regarding our 15 implementation plan projects or the outcomes? So I'd love to hear from everybody on these two questions, kind of blended or whatever, you know, whatever you feel like you want to respond to.
And
So yeah, go ahead.
One thing about that second question that strikes me every time I look at it is that you can think about those progress reports that we just talked about as the kind of thing that is about progress, not outcomes so much. So do you think people are more interested in that kind of thing, or more like the data that comes out of, that's about the results or the of those projects? So, but you want to we're going to the first one first, I guess.
I think we're gonna,
Whatever people want to talk
yeah,
about.
let's just hear from everybody if you're willing to speak on both of those questions. So you all got them in your packet. So Parneet and then Dan. Go ahead, Parneet.
I'm very interested in like continuing checking on the progress of the plans. It's more difficult to talk about and envision the outcomes and like successful measurements than actually engaging with the folks that are implementing progress on these projects, because they can give us like insight on what's going on, as well as like any feedback that can be implemented while it's making progress, instead of waiting until the end to see if the outcomes are good or bad. Yeah, so I personally, and I know a lot of individuals in the community are interested in the progress of these projects, of JPOP, of these meetings, and just how the county envisions a future of incarceration and all that good stuff.
Awesome. Thank you. Great. Dan?
Yeah, thanks. Good afternoon, everyone. I can just provide some anecdotal observations from folks that I talked to. Some Ward 3 representative for City of Bellingham Council, and Ward 3 includes the downtown Central Business District. I've been in fairly extensive conversations with many folks that work or manage restaurants or own restaurants and coffee shops and things like that. And so I wanted to speak to the first item. What would the community be most interested in seeing? And when you look at the 15 projects, I wouldn't say majority, but many of them are centered around behavioral health in some particular way, whether it's treatment, diversion, reentry services, housing, things like that. That's what I hear largely from the folks that encounter people in their day-to-day jobs, in their day-to-day life, that they want to see the individual helped and housed and get whatever treatment or services that they need. And that is like a recurring refrain from the folks that I talk to in the downtown core. So I just wanted to get that out there, that's what I'm hearing. And it's yeah, like I said, recurring. So thanks.
Thank you. Great. Hannah?
Yeah, I think that I think the progress and the updates on the jail are going to be the biggest thing for the community. At least that's what I'm seeing in my realm. And I also think that it'd really be great to have more regular updates as to our progress. I really like Trevor's idea of potentially, random updates about when we've hired somebody on the reentry team at the jail, so that they know that we have more capacity and the community sees that there's actually some action being taken, because we all know that the government is slow. And when we can see something a little bit more tangible, then there's more hope there. And I think it would hopefully ease people's concerns about what's going on, especially as it relates to the jail. It's a huge project that's going to take several years to complete, and if we're not getting regular updates, then we're not going to have people on our side as much.
Can I just say that I think this group is a great group to contribute those kinds of newsworthy items, like the example you just gave. And if you know of something like that that's happening that you think we should update the community about, if you can just send them to us, to me, or Holly and me, we can try to get those in through the into the social media pipeline, which we don't control, just so you know, but we can try and put something together for the right people. Just send us your newsworthy items. All right. Thank you.
Thanks. Tasha?
Well, I think over like an overarching as far as outcomes, I think overall people are supportive of these programs because they want to see the measurable difference, right? Which is like, we've spent a lot of time talking about metrics and what are we measuring. And I think it's, as we hire these, Hannah said a very, it's very measurable. We hired someone else and now we have the capacity to help X number of people. And then, beyond that, of the X number of people we helped, we reduced recidivism because now they're in this system and we've prevented a crime. Like, it kind of goes to that bottom right-hand corner, the increased safety, increased health, like reduce the number of jail bookings. Well, is that reducing it because people are not committing crimes is what I think more people are interested than just, we don't have room, so therefore we're not booking them. So it's it's artificial not booking people versus actually tackling the core problem versus a different symptom. So I think on outcomes, that's what I think of where I think we're really wanting to be distinct in how are we collecting the numbers, which I would say goes to the increase, build systems to facilitate communication and coordination between organizations and sharing of information so that we are properly tracking. So we could say we have a better outcome because they are better, not because they're just utilizing a different thing and we're not putting them into jail, even though they still are potentially committing crimes. Because if they're still committing crimes, but they're just not going to jail, they're using a different service, the overall safety of the public feeling might not change. You know what I'm saying?
Mm-hmm. Yeah, great. And for, you notice, Tasha was just referring, could we briefly, Marty, go to the next slide? Just so we can get that reference point. So this is, go up one. This is one thing, it's in your packet. It's a little hard to see on the screen, but these are the kinds of things, like anything on this is fair game. Like, yeah, I think we should be, focusing on this element. So just as we look at these questions, this is to help us prompt. And then our next question will be this column on the right, just so you know where we're going. Okay, if we could flip back, please, Marty, and Rob, you're up.
Sorry, I had to find the button. I think similar to what people have said, I mean, I struggle to separate the two because in some ways the progress is sort of like, what are we doing to get there? But then I think just as important is what we're doing helping us reach the goals that we want. And so I think you really have to be reporting out on both in order to show a full picture. To reference Tasha, what Tasha was saying, are they real differences or are they just inflated or artificial because of how we're choosing to display them?
Yeah, thank you. Okay, I'm going to call on people, and if you don't want to speak, it's okay. So I'm just going to go down my list then. Amber, do you have any thoughts on this?
Yeah, I really like what Tasha had to say. One thing that was just like coming to my mind is like I follow a lot of things like what people portray on media, right? Like that's like a lot where I get on social media, my communication on kind of like how people are feeling. So I was thinking about like whenever there's like a post of like a big arrest, like the community is like really like, yes, we're getting these people off the streets. Like there's like, you get a lot of like, great job, sheriff deputies team. And like, and then you see this like response that's like, oh, well, hopefully they don't get booked and release, right? Like that's like, it goes from like having this like super excitement for like the, now we're arresting them, we're getting this. And then, and so like, I think what, and I'm just coming from a lens of like hearing community members like with this negative thought of like, just book and release. Like that's like, and they have now to a point where they think that that's like standard. And maybe it obviously we know that it's not, and like there's a process, but I think having like those numbers available or follow through on, you know, the changes that are being made, and a lot of like what Tasha already said, you know, she probably said it in a better way, but I just think about what the community, how they speak on social media, what really gets them going is kind of the lens I was thinking. So yeah.
Thank you. Excellent. Okay, Barry.
Oops. Hey, everybody. This has been a great conversation. You know, I agree with just about everybody's comments and ideas about how we can get things out to the public better. And that's, to me, that's exciting because that's everybody understanding the real priority need for that. I know we're looking into what we can do through a little bit of boosting of some of the social media things over the next 2 years. Jill and I had a meeting with Kathy to talk about that last week. And so we're formulating a plan how we can carry that kind of forward and really have a robust social media presence for the task force and for the work that the JPOP's doing as well. So good conversation, everybody, and love being part of it.
Thanks, Barry. Okay, who's next? Dean.
I was really holding back as not being a member of the JPOP, but you know, I'm of course interested on those in those 4 questions on the right, or the 4 measures: the jail bookings being reduced, recidivism being reduced, and connections with service and those sorts of things, as what I think ultimately we're trying to achieve. Of course, the measures of progress on the projects is our means to that end. And so it's maybe more of a sequencing question of bringing forward some of the measures of progress, but then intermittently pointing out that these are intended to affect those 4 outcomes.
Yeah. Thank you. Well spoken. And Dean, I always forget you're not part of the JPOP, so thank you. Okay, Eric Ricci, you're up. Are you there? Okay. I'm going to jump to Hannah, and then Eric, I'll come back to you in a little bit. Hannah Fisk, you're up.
I don't have anything to add. I'm not part of the committee either. So.
Okay, you guys just have to correct me. That's all brilliant. Let's see. Jason Corneliusson.
Corneliusson, that's correct. I think people are going to, as others have said, the thing that the community will be most interested in seeing is anything about regarding the new jail. That's the question I get the most. It's also, I think, of big interest to hear anything about the programmatic aspects of the new jail, anything associated with the services that would be provided there, because I hear a lot of trepidation from people to hear the word jail, and it's, you know, big, scary incarceration, jail is bad, we're just, you know, feeding more people into the system. And I don't think that there's a widespread knowledge that the goal of developing new programming is to, you know, guide people along and provide reentry services, things like the transportation goals, and connecting people to supportive housing are aspects of the plan that go hand in hand with the new jail that people aren't necessarily super aware of. So I think just pairing those things and making sure that people are fully aware that all those things are happening in tandem would be very interesting to folks. And as far as the second question, I think in the present moment, I think people would be more interested in progress towards the stated goals rather than outcomes, just knowing that outcomes are so far out. It's going to be years before we really start seeing the payoff from these developing projects. So I think people are very interested in just kind of knowing where we're at right now.
Thank you. Okay, Mary Lou, how about for you?
So, again, I'm interested to hear the comments. It seems from what, was it Daniel that said the people in Bellingham seem to be much more concerned about providing mental health support and treatment in this, making sure that this is coming to the new jail. That seems to be a slightly higher priority than making sure that because of the jail bookings that people are being released onto the street. Certainly for a small town like Blaine, we don't have a very high crime rate. We are seeing problems with people with mental illness just because there isn't any available really good treatment for them. And so this is coming back as a problem. Also, this ties in with more and more evidence of some of the drugs finding their way on the street, even in Blaine and even in the schools. So this is what a concern is. And as far as getting out information to the public, I have had many interviews recently with all of the local news media and Canadian news media and ever about what's going on as far as Canadians coming across the border. And the news media have been very good about covering this and putting this information out, so that I'm getting all kinds of calls from other people saying, oh, I read about your interview, or I heard your interview. So I just wonder whether at some point just have one of the local media like Bellingham Herald or Cascade do an article on where the JPOP group is right now and what are its goals and how we're getting there. So these are the ideas that come to my mind.
Yay, thank you, Mary Lou. Okay, how about Miriam? Miriam, you there? Okay, I know you just came on the call, so we'll come back to you. Tank, how about for you? Okay, I'm going to keep going. So if I call on you and you don't answer, I'm going to assume that you're just stepped away for a sec or otherwise occupied. Trevor, are you there?
Yeah, I suppose in looking at those two together, I kind of echo the sentiment I brought up a little bit earlier around direct impact to community. My hunch is that if you're looking to tell a story, weaving in your progress towards your outcomes becomes important, especially if you can do it in sort of like a short and tangible way where people can just conceptualize what that's going to look like in their every day-to-day lives. So I do think that they're probably, especially if they're looking at these posts and looking for this information, one of the things that's going to be primary on their minds is their safety. So anything that describes how we are taking steps to ensure community safety or further community safety, and addressing kind of what Amber brought up, addressing those two parts of, yes, there's the immediate intervention, but then like, what are we doing systemically? If there's a way to kind of weave those together, I would imagine that would be the most impactful and carry the most positive message to the folks who are seeking the information out.
Yeah, thanks. And that's actually the very next question we're going to look at. This is also going to be kind of a, we'll have to stretch our brains a little bit. So anybody else, there's a couple more folks who haven't spoken yet. So Eric or Miriam or Tank, if you tune back in. And then I don't think we've heard from Peter or Rosa. I don't think you've spoken to this question.
And Parneet has
her hand up. Yep, I've got that. And maybe, I don't know, Hannah Sloan, I don't know if you've spoken yet to the question, so I don't think so. Yeah, Parneet, go ahead.
Oh, I just wanted to make some comments before we get into social media. I understand the importance of simplifying what JPOP is and the projects, because when I first started attending these meetings, it was difficult for me to process all the information. And it took me like reading and like speaking with you and understanding it as a young person that lacks experience working or dealing with like jail stuff other than, you know, my own lived experience of being incarcerated. But I want also like a communication more with like other JPOP members and those working very hard to create progress on each specific project. So it'd be great if they were also included in sharing out with like any social media or any posts or articles, so that we can get their perspectives on like the progress of each project. And recently, there have been comments about like public safety and how that is a major concern for all like residents in Bellingham and Whatcom County. And I want to remind folks that the homeless and the addicted and the mentally ill are also a part of the public and deserve to feel safe and have their needs met. So when all these things are like criminalized and it might not say specifically in written law, it's clearly like very difficult for individuals that are being trespassed and for camping, loitering, etc. These are all very important issues to acknowledge because a lot of individuals are going in and out of jail because of those reasons that could be diverted to other resources like behavioral health facilities, social services, housing support, etc. And I've noticed like public comment, even some folks have mentioned that they were very glad that their child went to juvie or jail and got clean. It's not the best place to face withdrawals, and jail has shifted from being like rehabilitation to just punishment. And there's a lot to work on that I want to really communicate with the community as well to help them understand like the jail that we're building is going to be better and it's going to have services that will meet needs that are not being met at the moment. And we're just constantly working hard to make sure everything's set. Thank you.
Thank you. Fantastic. And another, it feels like this is maybe the segue to our next question. So if anybody else who didn't yet get a chance to speak, who's a member, and for those of you who are guests here today, you will have time at the very end. So if you have thoughts, we do welcome those, but we'll wait to the end for you. So yeah, Peter, are you still on the first question? Marty, you might want to flip back. Or you jump.
Still on that, yeah.
Yeah.
Just so much to say here, but I'll try to keep it short. I do want to, I don't think it's been brought up yet, but STV, which is the company that is our, well, they spoke to us just recently, so you all know them. They're the owner's rep, and part of what they're doing is they're putting together a dashboard that will directly it'll be there to show progress and outcomes on the jail, which I think you're all right. It is probably top of mind for folks. And so we will be seeing that come together here in the next, I think it's next couple months, and will last the next few years through the project. So they're very professional, and that should be really helpful to us. But as far as what is the story we want to be able to tell the community through the data dashboards? Data, gosh, with these complex issues, we really need to have all the information for waders and swimmers and divers. Those are the three different types of information acquisition, and any one of us, depending on what the subject is, can be a wader who just might take 30 seconds with something, or a swimmer, which might take 3 minutes, or a diver who might take 3 hours on any given subject. And It is my contention that a government should take all the time and all the resources it needs to communicate thoroughly to all three of those different types on what it's up to and what it's doing. Governments, in my experience, are not very good at that. So if I were running things, I would have a lot more social media pushing out those different communications for those different types of folks on all of this very complicated stuff, and telling the story about where their tax dollars, where their votes are going. You know, they voted for the jail and behavioral care center, and with that, they voted also for these 15 projects. They should know what's going on, and you know, it's hard to get that information out there. Not everybody's going to come to a website and see it. So that's why social media is so important. And I was just interviewed for on this very subject by the Salish Current, and so they're going to be coming out with a good article on it. But how many of you all read the Salish Current?
Right.
Hands go up. I don't know. You know, it's
Oh, let's take a moment.
it's
Who
clever.
reads? That's a good question. How many people read the Salish Current right now?
Yeah, I mean, it's
not so
important.
many.
It's an important paper. They're important. It's select few who read it, but all of them need to be doing stories on this. And we can all do a much better job. And one thing I love about JPOP is that's something that we're here to do, is to go out in the community and tell the story in the ways that we can. So thanks.
And thanks, Barry. I saw your hand. Glad you're tracking on our behalf. Okay, Miriam, you're up.
Hey, can you hear me?
Yeah.
Okay, thank you for the grace as I'm dealing with some like internet outages.
No
Just wanted to echo what I've heard so far on progress and outcomes, and really stress the point of the progress being communicated to the community in a timely and thorough manner. I think that ultimately, you know, the community voted for something that they'd like to see, so they should be kept updated on how that's going, and also given opportunities to weigh in when it makes sense to. So that again, the progress will definitely play a huge part on the outcomes, because it will be part of that decision making that gets us to the outcome. And then I wanted to add that I think I mentioned at the last meeting that the commission, the Whatcom Racial Equity Commission, is kind of seeing this as like, hey, we're in this committee. What is it that the government needs from all of us in this committee to make sure that, you know, we're kind of each playing our parts really well to spread the word, to get better access to all these parameters that are needed for us to make better decisions. And so part of that is a data analysis project. And then the other part is, which we're still workshopping the name, but it is Jail Behavioral Care Center Follow Along, which will kind of be one of our little projects where we basically engage the community in a kind of form way, give updates, and then also allow for folks to just kind of bring us their thoughts and comments, and then, you know, being able to share it in this committee and with other committees that also play a huge part in the Justice Project. So that's kind of another thing. In terms of the questions, I can't really choose between progress and outcomes. I think both need to be they're both equally important. And then I was going to say, lastly, that you're asking us what we think the community would be most interested in. Can we just ask the community directly what they would be most interested in? Thank you.
Great. And this the follow along, that's what you're an initiative of the Racial Equity Commission is what you're talking about?
That's correct.
Gosh, that's awesome. Great. We'll look to, yeah, I'm excited to hear more as it gets going and the collaboration we can have there. That's fantastic. Okay, Hannah, go ahead.
Yeah, real quick addition to kind of what Peter was saying about social media. I think if we're able to and it seems appropriate, Reddit and the Bellingham subreddit is, very active about, thoughts and comments about the jail and arrests and everything that's happening in Bellingham. And our team, or a member of our team actually was approached and asked if we would want to participate in like a moderated thread that discussed, behavioral health services in the jail. And I said, no, not right now, but it is an option out there that I think people are willing to have those discussions and debates on. And if we could have somebody represent these projects in that way, I think it would be really great in getting the community actively involved.
Great, thank you. Okay, well, we're at the top of the hour, so we're going to transition to the next question, which is we're still talking about the data dashboard. But if this is a moment you would like to stand up or stretch or like look away from the screen for a sec, because we've been having our attention here on the screen for a while. So here's your moment, because we're going to look, and you can think about this question as you stretch or move. So the question is, looking at this right-hand column, and especially to achieve this impact, the bottom part, increased health, increased safety. I think Tasha had brought this up 3 months ago at least. It's like the public wants to know about increased safety. So when you look at impacts, what indicators would you use to convey improved health and safety relative to the criminal legal system and behavioral health system? This is a bigger, gonna take a little mind stretch here. Increased health and increased safety. So think, all of us thinking here about, you want to tell the story, or you want to know and be able to communicate. We have increased safety in our community. And as Parneet pointed out, it also includes people on the street, right? Like increased safety for everybody. So what kind of measures would we use, or how would you communicate those, the metrics of that kind of desired impact? What would that look like? So I'm going to go through the list again, but we'll start with just whoever is ready to speak. Again, if you want to pause and stretch, now's a good time. You can do it with your camera on or off. We're all friends here. Okay, Hannah, you're up. Take us off.
I think a big thing that is happening and being discussed right now is overdose rates. And I know the health department and multiple agencies are part of the MAC work group for opioid response, but I think that would be a really good indicator of how safe and what improved health outcomes we're seeing in the community, especially as people, are releasing from jail. We're providing them with Narcan. Is that helping at all? It's hard to really tell what is actually making an impact, and what are we doing that's effectively reducing those overdose rates. And then obviously, I think, the rate of violent crimes in the community and how those go down with each, diversion program or something else.
Awesome. Okay, overdose rates, rate of violent crime. Good. Who's next? Yeah, Rob.
I think looking at are people started on medications while in custody or diverted from custody, and is there a warm handoff or a connection back to ensure that they continue those services or medications or whatever it might be that they need?
Mm-hmm. So that story really, if people are incarcerated, that they are actually being, they're getting the warm handoff and they're getting diverted and they're not going back into jail, but that nor are they, and they're not committing crimes again because they've gotten that warm handoff. Yeah, good. Okay. Amber, you're up.
One of the things that I was thinking about, I just think about kind of doing assessments and like clients that come in that have Hep C, and or clients that come in that have diseases, and then they always speak about getting that treated, right? So like I think that kind of falls under both increased health and safety, like letting the public know like this many clients were treated for Hep C, or this many clients got just like the MAT, but like other safety concerns. Another one that we started doing is like follow-up, this is down the road, but like how many people are staying clean after they complete our program, like 1 to 2 years down the road, like and that's like, obviously we're going to track that, but like knowing more about that would be helpful, right? Because that's what the community wants to know. Like, how successful was it? Was it just really successful for a small period of time, or did we over a longevity period? So those are just kind of some thoughts that were coming to my mind.
Awesome.
I just want to ask you a question, and this is for Hannah and all the other providers who are here. I think that longitudinal data, like what do people look like a month, 6 months, a year, 2 years out, is so key to telling the story and understanding if there really is improved health and safety in our community. How hard is it, do you think, to keep track of people, to do that kind of check-in and know where they are? Like, is it possible, or potentially, or nearly impossible? What do you think?
Yeah. Oh, go ahead, Amber.
I know that like, because by the time they're completed here, they're stable and they're often have a residence. And so it's just something that we've implemented in the last like 3 months, but we're getting responses, right? Like these are people who completed a year ago. They're still at the same address, and we're seeing like more response than we thought we would see, right? And they're like responding, they still have their job, they're still sober, like and so for us, being with them the whole way that they've been, so I don't know if that answers your question.
Yes, that is such good news. So your program is a resource for longitudinal data. You can get them. You can track these folks. That's really great to hear. What were you going to say, Hannah?
Yeah, that's actually why I raised my hand, because when Rob brought it up, I think it's really hard for us to track the people when they're released from jail, even if they're, it's really easy for them to get connected with medication assisted treatment, with MAT services or MOUD. But it's hard to track to see where they're going because everything is so disjointed, and we have several different agencies and providers that offer the same services, and we don't know where to locate them. And then it's made harder when we can't maintain contact with them from a reentry perspective because they don't have a place to live. And so we try and give them a phone, but if they have no place to charge it, then we don't know where they are. So it's really difficult unless we know like exactly who they're connected with and they're regularly attending those appointments. It's hard for us to follow them long term. But yeah, I think what Amber said is really awesome when they're in services and they have a place to stay, and that's stable. We can get those responses that are really really important for us to do this work.
Awesome. Great question. Thank you, Marty. Okay, Tasha, you're up.
So just kind of following up with Hannah and Amber, I guess when I think of like metrics, do you guys keep track of those that maybe you offered the program to, they did not decide to engage in your program, and then like show comparison to those that stayed in the program and successfulully completed it, and their success rates versus those that decided not to engage in the program. Because I think, we've talked briefly about this before, is having that kind of control group that does not engage with any of the programs, or maybe engages with one program or doesn't. But as she mentioned, there's several different programs that you can surround people with. And so is it better if it's a minimum of 2 programs that shows a better success rate than no programs? Or is there 4 or 5 programs that's the best? Like, what is the best practice? And then speaking to the communication issue, we have this as well. I'm on the high risk domestic violence. It's one of the committees I'm on, and so we're people that working with victims and suspects, are people that are the high risk offenders. It's a surround service. We have monthly meetings to talk about. Do you guys have something similar in your in the behavioral health side or the SUD side of, without violating principles, that you guys can come together weekly or something and go, yeah, I know this person, I know he's in Lifeline, I know he's in LEAD, I know he's in Grace, where you guys are kind of allowed to do something like that? Do you guys have something similar to that? Is my question. I don't know.
Amber or Hannah, do you have a response to that?
We do. We do have a lot of interagency, check-ins monthly and bi-monthly. I think when we're able to connect with Grace and LEAD, it's a lot easier because clients that work with them sign universal ROIs. So we're able to release that information and coordinate with each other. When it's agencies that don't work together like that, it's a lot harder, and we have to try and connect with the client and get a release of information or an ROI signed. And it just doesn't apply for a lot of people that aren't in those specific programs.
Can I ask a follow-up real quick?
Yes, ma'am.
Is there a particular reason why a program wouldn't want to be involved? And are the people supporting programs that are more willing to be a part of a group like that versus programs that don't want to? Or is there HIPAA or other rules that prevent that cooperation?
And other people can speak up too, but yeah, HIPAA makes it really difficult, and some agencies just aren't willing to do even just a basic release of information from agency to agency can look a lot different based on what the agency and their legal team requires for their release of documentation. And so it's really wonderful to have LEAD and Grace where they do have those universal ROIs, but like sometimes one agency won't even take another agency's release of information. They have to have the client sign their specific form. And it's just, it just makes it really, really hard.
And I just wanted to add, I also think it's also on the client's willingness, right? Like, because they don't come in all ready to have like those wraparound services. Like, we're ready, let's do it, let's jump on board. But that takes a little buy-in. And sometimes if they're tiptoeing on that line of like, am I still using? They don't necessarily want because once, at least at my agency, once you sign an ROI, I have to report any use, right? So like, they're not necessarily on board right away. Now, can we get there? Absolutely. But so that's a barrier I find. I don't know, Hannah, if you have the same one.
Yeah, absolutely.
Yeah. Seems really connected to this our project number 5 of increasing building the systems to facilitate the communication and coordination between organizations. Like, what's the result? What's the benefit of that? And then is it happening, both the outcome and the process?
I'll also add to that, HIPAA's one thing, but then we also have 42 CFR, which applies to substance use treatment. So if it's a substance use agency, which Lifeline Connections is, and other providers, but like Lifeline, even if we're working with somebody as a mental health patient, we're still a substance use disorder agency. So 42 CFR applies to all of our documentation. And so it's a lot harder. That is more strict than HIPAA is. So it's really difficult for us to share with others without our specific ROI.
And do you want to, that you did 2 acronyms. You want to describe them, CFR and ROI?
Yes, ROI is release of information. CFR, I don't know, Amber, you might be able to tell me what it is.
42 Part B.
What?
So it's CFR, confidentiality federal regulations. 42 CFR Part B is a federal law that really was designed to keep people who are getting services for substance abuse treatment to protect their privacy, because at one point they were being discriminated against by employers, by the court systems, etc. And so that law came out, I don't know, it's probably 50, 60, somewhere in there. And it's kind of the, I guess, the Bible, if you will, of confidentiality for programs that are substance use programs. That's probably the easiest and simplest answer to it, although it's very complicated. I
Yeah.
think the other piece that I just tag on to Hannah, I think, programs historically, we've just been very siloed. And so we don't, as a practice of care, really think about coordination. And so I think that adds to the issues around confidentiality.
Thanks, Rob. That you did explain it really clearly. Thank you. Okay, Peter, and then Parneet, and then Miriam. Go ahead.
Couple things. We are so siloed here. It's and until we start until project 5, which is about communications between the different silos, I'm not entirely sure we're going to ever be able to make it, to tell you the truth. What we saw, though, in Nashville, again, Nashville had a very interesting model for all the justice involved folks. They had one agency. It was called the Mental Health Co-op, and they were the one agency that dealt with all the folks with mental health issues in the Nashville area. So they were represented everywhere we went, whether it was the BCC, whether it was in the jail, whether it was at their crisis stabilization, whether it was at reentry. It was one agency, and so they did not have all this cross communication, cross silo communication problems, because these folks knew these folks at the individual level and were able to communicate about them. And until we can do that in this community, and get down to that individual level and understand them as people, actual people, and watch where they go, and I'm not sure how we do it. So I have been, ever since we saw that, I've been a real advocate for it's a heavy lift because all the silos have all the protections that every silo does to maintain their existence. And it would be interesting as a community to make a decision to go to a model like the mental health co-op. On increased safety, I think going back to Dan's statement earlier, business success, business openings, and would be a really interesting way of tracking public safety. When we lose businesses, often it's because of perceived chaos in the downtown region, and they're losing business because of it. Also, to that end, maybe tracking projects that put residential projects in the downtown. We've not had any projects like that in years, and it's to a great degree because of the perceived chaos in the downtown. And so I think that might be something to track, to show how people are feeling, success of events and numbers of people on the streets, etc. Thanks.
Thank you. Okay, we're going to run a little short on time. So for our next speakers, if you can just be thoughtful about time, and then we may need to transition. So if you do want to speak to the question, get your hand up and go ahead, Parneet.
Just real quickly, Northwest Youth Services Outreach met with Lifeline just 2 days ago, and we do have a lot of barriers when it comes to like making sure everybody has an ROI to share about like young people and just young adults as in general. Data is very difficult to collect, organize, and share across agencies. So if you want to have like discussions about is the health and safety being improved in our criminal legal systems and behavioral health systems, we really need to remove those barriers that prevent like voices from being sharing their experiences and like their thoughts on what they experienced.
Awesome. Thank you. Great. Miriam?
Just thinking about the disproportionate number of people of color that are arrested and incarcerated in Whatcom County as a measure for seeing increased health and increased safety, since we know based on data, research, and also our own county identified racism as a public health crisis. One of the kind of doing the data analysis will help kind of uncover some of these things. But I think that should be a really important indicator. I also look to an indicator I haven't heard talked about in this space is policing. Because of just hearing from the community the impacts of policing in different ways and having experienced things myself. Let's see what else. I want to make sure I'm quick about this. Yeah, because I think there's a bunch of other indicators, and so far I've really heard about mental health and substance use and these are like health, very direct health care, more traditional healthcare indicators. And so I'm also looking at less traditional indicators of health and safety.
Great, thank you. Hank?
Yeah, so with regard to the amount of people arrested that might be marginalized, I think what we need to do is dig a little deeper to look into which agencies are the identified folks being arrested by. And I think what you'll find is in terms of our tribal communities and our tribal police, that most of the tribal members, perhaps not most, but some, being arrested are tribal members by tribal police. But I think just doing a deep dive into that, and not just tribal members, but all marginalized people arrested, and maybe like a 5 year, going back 5 years, would also, I think, give us some information, and that information might shed some light. So just any thoughts on that?
Yeah, we did receive data from 2023, 2024, and so far 2025 from Sheriff Tank. And so when you say 5 years, like, oh yeah, like send me over the other stuff 100% as we embark on this data analysis, because and I think your point around the policing and which agencies are doing the arresting is extremely important and relevant. And so we're really looking forward to do that deep dive and get, you know, just the community's feedback. And Sheriff Tank is also on the Racial Equity Commission. So really excited to just like kind of loop you into all of these things.
Great.
Thank you.
Okay. Any other comments before we move on? Okay, so let's, you know, we still have time on this, not today, but in general, to think about these measures. So if things come to you in the next day or two, like here would be a measure that we could use or an indicator, or even asking people in your community, like, what do you think it would, how would we know that our community was more safe or had the perception of increased safety? How would you know? It would be this is a really good time for all of us to be thinking about that so we can inform this data dashboard. So Tasha, yeah, last comment.
Just wondering, like, because we always seem to circle back to number 5 on the systems to communicate and facilitate communication. Is there, and maybe Peter can speak to this, is this part of IPRTF? Is there like maybe, I know you just did a behavioral health, and maybe this is part of index. Is there a specific work group that is looking at all the different systems specifically to see, and then comparing them to federal laws, the CFR, and like HIPAA laws, and what can be, what we can do, you know, before the potential of this jail, the BCC opening, that we have those changes in place so that we are prepared for that.
I can speak to that briefly. That would be in the Behavioral Health Committee. It's not a top priority at this time. It is really a difficult one, as we've talked about. So very interested in it. We're not tackling it in any big way.
Tasha, I'm wondering too, if both of you've mentioned the co-op in Nashville, I wonder if that might be another potential speaker, somebody from that co-op, like how did that get created or what's its makeup? How did they deal with these issues? So
That
maybe
would
that's
be
else we could, yeah, find and have as a opportunity.
Is that like, can I just follow up? Is that part of one of the reasons why some more of the stuff is under the health department, so that is the overarching similar to a co-op, or is that not the same?
It's not the same.
Okay.
And I'd love to talk to you about this for hours. Probably now is not the right time, but anybody interested in it, please reach out to me.
Okay. Yeah, and I would say, Peter, if you've got any information you could send us that we can get out to the group about that, the co-op, that might be a really good thing too, for us to just be able to look at, okay, what did that look like? Is it something we could replicate here? Okay, gang, we should probably move on. Yeah. Again, so if you have other ideas after today's meeting, please jot them down and send them over to Marty and I. And we are ready for the next section. Okay, Justice Project Implementation Plan Progress Report. So Marty, take it away.
Okay, this was the big chunk of text in your packet. The report, we gave you the full report. The full report is the required Incarceration Prevention and Reduction Task Force 2025 annual report. And it has 2 parts: the usual part that they have to do every year, which is a report on their the IPRTF's activities. And this one builds on a year-end report, which was in December. So so we've got the full year with this next chunk of stuff that you had in your packet. And then, as Holly said, for the first time ever, we have the implementation plan progress report. And that was written by drawing from the executive's office quarterly reports, and it focuses on the same 15 projects, talking about their progress. And for this 1 year only, it starts in November 2023 when the sales and use tax passed, and then goes through through till June. Future years, we will have a July to June annual implementation plan progress report. So the time frame's just a little different this time. And I hope that you had a chance to look through at least the implementation plan progress report section. And we, at this point, we're just trying to move to a final draft. And so we want to make sure that everything that we have in there is as complete as we can make it at this point, that it is accurate and clear. So these are the questions for you that we have here. Just, did you notice anything in the report that felt like, oh, wait, they didn't say anything about this critical thing that's missing? Or did you notice anything that seemed inaccurate, irrelevant, or unclear?
Okay. Or if you want to say how much you loved it, you can say.
Oh yeah, we'll take that too. And I will just tell you that where we are in the process is gathering this kind of input from as many IPRTF related people as possible. And then we're going to be drafting the final report and the executive summary once we feel like the information is solid. It will go before the IPRTF for approval in June. So Tasha, you had something?
I'll fully admit that I have not read every single word, because the one thing I really appreciate and love is that you have links to all the different, like you have a link to the Vera, like, so you describe it, the Vera report, and this is how we got to this place, and I'll link on that. And then I realize that's like 40 pages long, and I kind of get lost in catching up on that. So for someone that is new in this work on committees, around this subject from the last year, I really appreciate that this kind of sums up all the work of the last 10 years into one succinct document where it's easy to link to all the different projects that have been accomplished thus far. So kudos on that side of that.
Thank you. And I want to give kudos, pass them along to Jennifer Moon, who has been working with us on the report. And so, yeah, she's not here today, but we are very grateful for her help with this report writing.
Okay, anything else?
Okay, if you see anything, please send it by tomorrow. We're really trying to wrap up our feedback period by tomorrow. And then we will, as I said, move on and get a final draft and get that to the, say that again?
And the executive summary too.
Yeah, and the executive summary. And we'll give you a link to that once it's all done. Okay, ready to move on to this? Okay. So this next part is about focus groups that we did with people at the work center. And Holly and I and David Goldman and Caleb did this. So we had on, this was on May 6th, we did 2 groups at the work center. And we had 11 participants total. And I'm going to tell you about what we found from those groups. And I want to just remind you that one of the reasons that we wanted to do these groups is to gather information that will help us from this small group of participants, that will help us refine a survey that will go out to the full jail population. So that's the next step. This is just a little background on our methods. The participants were recruited by deputies who went around and did a kind of standard invitation, and they asked people who they felt could participate in about an 1.5 to 2 hour process and would want to, they were volunteers and would have something, be able to contribute well to that kind of conversation. Before the group discussion, Caleb showed a 15-minute video of the Franklin County facility, and that's in Tennessee. And no, I'm wrong, Ohio.
Columbus, Ohio.
And that is a like a behavioral care center there, a jail and behavioral.
It's a trauma-informed design jail. They are building their BCC. It's not built yet, but we were very impressed with its build out and all the various features it had.
And the video discusses that facility and how it's structured. So they got to see that as an example that has been an inspiration for some of what Chief Erickson and the group want to have in the new jail. They were given a handout with the focus group questions so they could look at them ahead of time. And they were also given a handout of what we call the wish list, that is about what kind of features you want to have that are desired in a new jail and behavioral care center. You got to hear about this and see the wish list and hear about it from Caleb Erickson in our, I think it was January meeting when he came and talked about that. So Holly did the facilitation. David Goldman, who is the educator at the jail, was there for both groups and asked some probing questions, put things into different words to help us, just try and solicit more information. And I was there taking notes, and I'd say the groups went really smoothly. They were, we learned a lot from the first group to the second group. We used the same 5 questions for both groups, and I think you saw a draft of these questions at that January meeting, but here the questions that we asked were about services they felt were most important to offer inmates in the jail and in the behavioral care center, and then trying to focus people on ideas for the design of these facilities, being, what did you hear about when Caleb talked, and what did you see in the video that you think would have a positive impact on inmates' mental health and overall well-being. We did not want people to kind of go into, I wish we had different food at the jail, or I wish we had, I wish the guards would, not do this or that. We were really trying to keep the conversation focused on design of facilities and services that would be in a new facility. Okay, there were 2 more questions, and those were any other ideas for the design of the facilities that they didn't see in the video or hear about, and any other services that we hadn't talked about. This was the last question. Anything else that we haven't heard about so far? So now the results of these groups. Oh, here's the wish list, and that's probably hard to read on your screens, but I'll focus in on the next slide here. So we felt that the content, that what people said during the groups affirmed the wish list. And what you see here on this slide are on the left in the lighter blue. These are items that were brought up repeatedly by the participants in the group. They were about the natural design. So they talked about light, wanting more color, less stark, art on the walls, access to outdoor air, those kind of features of natural design. They talked a lot about an item on the wish list that it says build skills for living on the outside. What that means is spaces in the facilities where people can develop their skills. It might be job training, learning to cook, using tools, learning how to do their own laundry, things that will help them be able to live more independently on the outside, and help them have some autonomy when they are in jail. safe space for people in high crisis. And that's kind of related to co-locating the behavioral care center or with a prosecutorial diversion program with the jail. So people could be transferred there who are having, who are in need of behavioral health services. The items on the other side, the right side, are the other wish list items. And these were agreed upon. They might have been referenced kind of in passing. People might have made a comment to Caleb like, yeah, that sounds good. But they were not ones that were necessarily they didn't keep coming up throughout the group. The next things I'm going to talk about are some key points people made. So a theme, these are going to be themes that we saw in the conversations. And one was when we kind of asked about the structure of the of the building, how many people would be in a room or housed together, and what kind, like one thing that came up a lot is it's not so much the number of people in a cell or a tank or a room, it's who the people are and the group dynamics among the people. So some groups really when you get a certain people together in a room, there might be more conflict than is desired and normal. And so trying to get the people, get good positive dynamics in a room. And part of that is if somebody's in a mental health crisis, trying to get them out of the cell where everybody else is, but not into what's called 23-in-1 lockdown, where they are in their own cell and not allowed out, but getting them into a safe space that is designed for their care with people helping them. Yeah. This is related to what Hannah Sloan told us about in the Making Changes pilot program of getting people together who are really serious about improving their lives and staying out of jail, and trying to make, help them have peer support each other to do that. And so having perhaps separate programs and units that are for people who have said, I really do not want to come back here. And part of that is addressing challenges with substance use disorder, mental illness, and freeing oneself from gang violence. And we heard how hard that is. All of those things are, and that a lot of support is needed. And like I said before, with, if the group dynamics in a cell are negative, people want to be able to put in for a request to change rooms. Other items that they mentioned were the importance of visitation and technologies to support their connections with their loved ones, maintaining those connections, spaces for indoor and outdoor recreation and physical activity, and the positive benefits of having those spaces, being able to have outdoor recreation, and even yoga classes indoors. Like, people want to reduce their stress that way, and they see the positive benefits for group dynamics as well when people can get their yayas out through physical activity. Food and nutrition is important for helping people feel better, and they want to be involved in growing and cooking food. And they're sometimes hungry, and they want ways that they can feed themselves. And right now, commissary access is limited. They don't necessarily have hot pots or microwaves, things like that they wish for, so that they could take care of their own food needs and be less hungry. I mentioned just now some of the amenities people asked for. And these are also things that help them exercise their autonomy. So you can see this list on the right here, and down at the bottom in the blue box. One of the items on the wish list is like equal access to services, equal access to everything for all, where you have the same things in every tank or cell. And I think that was affirmed, but people also like having the system of working toward increased privileges with good behavior or with involvement in groups, with showing that they're trying to improve their lives. And so some people get more privileges than others. And I think people seem pretty bought into that system and motivated by that. And we heard a lot of comparison with between our jail and prisons, Western State, Hospital Detox Center, and our jail was like, not looking great compared to those facilities. People are like, I'd rather go to, one guy said, I'm slated to go to prison today, and I put in for that. I'm okay with that because I would rather do my time there because the better services and better amenities. And so that's kind of a powerful statement. As far as services go, speedy access to services at each of these transitions would increase successful rehabilitation and decrease chances of recidivism. And I'm sure you all know that. We heard it from the inmates we talked to as well. So services in jail that they desired are behavioral health services. That's both for substance use disorder and mental health support. And more to do, just more to do in jail so that they can develop skills to improve their prospects for the future. I'm whipping through these because I know we're short on time. And the slides will all be posted online. I just want to assure you, you can go back to these and read the details if you're it's going too fast. When people are ready to move from jail to outside, the reentry planning should start from day one upon incarceration, and set up people for success on the outside. One idea I hadn't heard before. One idea I hadn't heard before is idea of a halfway house being the last part of one's incarceration. Somebody brought this up, that you could complete your sentence in a supportive housing environment, maybe 10 days or a couple weeks in a supportive housing environment to help you transition back to the community. And then a lot of other services people hope for in helping them make a smooth transition or a warm handoff to community programs. Once people are back in the community, they are wishing for the kind of services that we know are needed, case management and housing and substance use disorder treatment being primary. A sponsor was one that came up that's kind of interesting, like an AA model, but for people who've been incarcerated, a peer support in the community, and then vocational support and family support. And then we pulled a few quotes that we thought were just especially poignant and show that, people really need a lot of support to feel like they can succeed in the community and not just stay in the cycle they're in of going in and out of jail and addiction. So it's inspiring. And now we're gonna, Miriam, I did want to, sorry, I'm gonna go back here.
Hey,
Mary,
Marty,
want to
I'm
comment?
sorry. Marty, I wonder if we might want to table the Tijalik report out because it's almost 10 till. So yeah, Miriam, go ahead.
Can you hear me?
Yeah.
Okay. Does the Justice Project have a philosophy beyond the theory of action design?
That, I'm not sure how to answer that. Can you say more?
I hearing a lot of the just, going through your interviews here and wondering if in the quest of reducing incarceration while also building a jail, that we're kind of feeding into the problem more than we think. And so a philosophy beyond the theory of action might help us design something that leads us to not incarcerating people and more to providing people with services they need in order to keep the community safe. I'm not sure if I'm making sense, but thinking about, right, like, because we're saying, oh, these inmates are talking about the jail designs. And also we want to reduce incarceration, but we're gonna be building a jail, and ultimately we want to provide mental health services. Right. So is the philosophy that we see the jail and behavioral care center as a space for rehabilitation and community care, or that ultimately we are still incarcerating people and then providing them with services? Because if just thinking, and maybe I'm kind of going way off way off to the side here, but if we're I'm having a tough time with kind of everything being shared and knowing what, I'm just having a tough time understanding.
So I think one of the things that I'm noticing, because this came up at our last meeting too, is that the whole process of the needs assessment and then the stakeholder advisory committee grappled with these questions that landed us on the implementation plan, but not everybody was part of that process. So your questions are absolutely valid, Miriam. It's like, and I think that might be something we just need to pause and say, we need to get everybody on the same page with where we're at so it makes sense to everybody where we're at and the decisions and choices that have been made so far. I want to, though, I just feel like I see everybody's hands up, but as your facilitator, I feel like I need to honor the 10 minutes of public comment. So what I'd like to do is just shift to public comment. And then if we don't have anybody who wishes to speak to that, we can pop back into this discussion. So let's just do public comment right now. Anybody who's not part of the JPOP who's been dying to speak this whole time, who would like to chime in.
I did see Arlene's hand up, and Arlene would be in that category.
Arlene, do you have something to say?
I wanted to answer the question that was asked because it's true, it hasn't been discussed in that way as a philosophy. We as individuals came to this committee in the first place because we have feelings about the philosophy of treating criminals. From my point of view, it is pretty much mental health. That's why I have advocated for the clinic of the 23-hour crisis clinic, because I want to get at the source of where it starts, where the problem starts of people getting into trouble and so forth. It's at the beginning, I think, of people's lives. Sometimes it involves family therapy, individual therapy, group therapy. But I think that would help. It would not completely solve it, of course, but it would help reduce the number of people that we have going to jail, not provide a source of more people. While they're in jail, we want them to be treated civilly. And so we're working very hard at that. It's not that we love people being in jail. We haven't found the alternative way of treating the problem. But it's certainly true that we haven't published a philosophy of our ideas about criminal behavior. And of course, we do acknowledge that much of it is cultural and societal. We know that that's important too. And that our society also breeds criminal behavior. I think we have it at the top. And we've had it more throughout our history. And more of that is coming to view.
Thank you. Thank you, Arlene. Okay. Any other folks here who are not part of the JPOP who would like an opportunity to speak? Is there someone in the conference room who's not part of the JPOP? I see a hand up, but I don't know if that is our guest.
She's hiding.
She's hiding. Okay. So, Barney, if you can put your hand down, please. And then right now I'm just looking for people who are here as members of the public who would like to speak. Okay. So now I'd like to just see, gang, we did run out of time to do the feedback on the Dijwalik tour. Can we table that to the next meeting? Or is Dan or anybody else feel like we need to just take a moment for that? Okay. So we're okay with tabling then? Great. All right. So then we'll go back through some comments on this, the theory of action design. And actually, Marty, could you go all the way back to the first slide, which I think really is a portrait. It's the one that we always start with. It's a diagram, graphic illustration of, I would say, the theory of action of the implementation plan. And if folks, just as we take another couple comments, I saw a couple hands, and we have about 4 minutes left. And so folks who wanted to speak to the question of what's the theory of action that was that this is based upon. And if you could keep your comments short, then we'll be able to hear from everyone. So Parneet, I think you're next.
Thank you. I just have testimonials from current and former Whatcom County Sheriff Office employees from April 2025. They advocated in public comment in front of County Council to build a new facility for the sheriffs. And I wanted to just be able to share that with JPOP if that's possible. I have a combination of like a PDF. And also, I really want to speak up on like justice. Right now, currently, like the federal administration is pushing back on abiding the law. And we have to really focus on building a community and prioritizing human life over property. And yeah, that's like, shout out justice.
And Parneet, if you just send what you would like to share with the group, we could attach it to when we send out the meeting summary. Thanks.
Great. Tasha?
As I feel like on the law enforcement perspective side of things, and recognizing, having worked with all these systems for 25 plus years, I always feel like I have to come back to the victims of crimes. I know we're always trying to help people who have committed those crimes, but we have to have a huge perspective on the impact of victims. We think about not booking people, but I've looked serial rapists and serial killers in the eye, and I don't know that, I just think that that has to be also part of the equation. A huge part of the equation is what trauma are we putting on victims by being so focused on making sure that the person who committed a crime against them has received all these services that maybe they don't have access to these services as well. So I think you need to make sure that there's always a balanced conversation.
I just want to know, I'm just going to say this for the record. I am a victim of crime. And I still believe that we can do better than jails.
Thank you, Mary. Okay, Tank?
Yeah, it would be great if we had a society that was able to self-police ourselves. But I think, as we just heard from some victims of crimes and from law enforcement and others, that our society doesn't do well at self-policing. And if we did well at self-policing, then the crime rate would be zero, and it's not. But I do agree that there should be a balance. And what Arlene said is true, to get at the root causes of criminality. However, if you look at the jail that we have, and if you look at the plans that are in place, and if you look at the plan for the behavior care center, the purpose of it is to divert people from the criminal legal system to care. And that's the reason why the prosecutors and the public defenders and others are part of that plan. But we have to have a place for people that are not diverted to be held accountable. And when you looked at victimization, and I could tell you, coming from a family where my family has had many victims of crimes, but also suspects of crimes. And there has to be a balance. So I believe the idea of saying that we shouldn't build a jail, I don't buy into that idea, but I do buy into that we should have a balance, and we should have facilities, the behavior care center and the jail, where we can hold people accountable, but still have systems where we could rehabilitate people and where we could reintegrate people. And that reintegration means services, it means job training, and the like. So I don't think it's a either or. I think it's a and. Thank you.
Thanks. And I think it really reflects what's on this design, which is really how the implementation plan is constructed after all of the discussion and all the research that went into the needs assessment, is this holistic vision. And some for prevention, community health improvements, incarceration prevention and reduction, healthy and humane facilities of multiple types, aiming for increased health and safety. Again, what's our outcomes? And this increase, see the little arrow up on the far right, of accountability, data, inclusion, and transparency, which is really all part of what the JPOP's about, right? So I think everybody, if you haven't looked at the incarceration or haven't looked at the Justice Project, the needs assessment, and everything that's gone into this conversation, then we can keep on just building on what we've got so far. I also want to just then you can stop the slideshow, and Marty, and just say thank you. This was such an awesome meeting. I really appreciate how much rich content we had. I really appreciate folks who came today as part of the public. And I hope you all just have a great rest of your week. Oh, Marty, what was our last slide? It's our remember we were going to put it the last slide. So next steps, our next steps. So we'll punt that conversation about the Jijwalik tour, which I heard was awesome. And then we'll get back together on, what's our date?
June 26th.
June 26th.
Yeah.
Okay. Thank you to our co-chairs, as always, for help planning the agendas. And we are adjourned. Bye.